The supplies that you will need for your wound dressing change are an ABD pad, gauze sponges, cotton tip applicators, your specimen cup and sterile water, tape, sterile gloves, and measuring tape. In the state of Georgia, dressing changes are not done using sterile technique, but rather a clean technique. We still want you guys to know how to do it, and we are testing on the principles of the sterile technique rather than the actual procedure. The first thing you want to do is ask your patient if they're experiencing any pain right now, because this procedure can be painful and we want to treat the pain before we add any more pain to it. First, let's find where our wound is. And in this case, the patient's wound is their abdomen. And we're going to provide enough privacy to where we only access the wound. I'm going to bring the table closer to me. That way I'm not turning my back to the patient. Now it's time to expose the wound. I'm using clean gloves for this process. It is not sterile. Once we have the wound exposed, it's now time to assess it. What do the edges look like? Are they red? Any drainage? Any odors? We will document all of our findings into the chart. Now we need to assess by measuring. We're going to measure the length of the wound using the centimeter side. We're going to measure the width of the wound. And now we also have to assess the depth. So in order to assess the depth, we need to grab one of our cotton applicators and only open it to where we can push up what we need and keep the other cotton applicator sterile, because we're going to be using that later. Bring your fingers down to the point where you've reached the depth, and you use what you have to measure on the centimeter side. As you're measuring, make sure we are not using the measuring tape to touch the patient's skin or the cotton tip applicator, because it can contaminate the reusable measuring tape. If your gloves became soiled from touching the wound and the patient, you can remove the gloves at this time. I'm working my way down the table, so I'm going to start with the package closest to the patient first. Be mindful of your 1-inch borders that you can touch, and you're going to open away from you. Make sure that as you're opening each package, the flap doesn't fall back down on the supply. Be careful when opening up your cotton tip applicators, because remember before we open it up just enough. It would help you to open this one up slower than the others so that the remaining applicator doesn't turn or fall on the table. At this time, you can go ahead and set up your sterile water. So you'll open your cups and place the lids inverted on the table, and you're going to pour your sterile solution into the specimen cup. You can also go ahead and set up the tape that you're going to use to secure the dressing to the patient's abdomen. So you'll tear off 4 pieces of tape, and then when you tear each piece off, make sure you label one of the pieces with the date, time, and your initials. Now, the last thing that I will put on are my sterile gloves. This step is saved for last because you cannot open up each sterile field with your sterile gloves on. So remember to put your sterile gloves on last. And as you can see, I'm opening my gloves at the end of the table facing the rest of my sterile field. Once I have my sterile gloves on, I can now touch my supplies. Really, all you need is just one piece of gauze, and you're going to ball it up or fold it up like so. And then place inside of the sterile specimen cup, only touching the gauze. Make sure the gauze and the water are the only thing that touches. If it touches the rim of the cup, then it's considered unsterile, and you would have to get another piece. You'll wring it out above the cup and fluff it in a way in which it's around the shape of your patient's wound. And now we're going to use our cotton tip applicator that is remaining To pack the wound. Make sure that as you're packing the wound that you're not putting any of the gauze on the patient's skin because that can cause skin breakdown. Now get your ABD pad with the blue line to the sky and place it over your wound, covering all edges. Lastly, grab your tape and secure the ABD pad to the patient's skin with the tape. If necessary, you can adjust the size of the tape that you need. Once you've secured your dressing, make sure that your patient is now comfortable and that after you've gotten them back into a comfortable place, you grab all of your trash, clean up your area, remove your gloves, and perform hand hygiene.